Yay. Okay, we're off to a good start. So we see everybody starting to roll in. We're just gonna let that go for a second or two before we get started. Thanks for joining us today. We'll just wait a few more seconds. It takes a little bit of time for people to get from the waiting room into the session. And okay. We'll go ahead and get started. Hi, everyone. I'm Karen Thompson. I'm the Director of Operations at Grow and Lead. Thanks for joining us today. Today's webinar is the second in a series of 4 mental health webinars that are being provided in cooperation with Great Lakes Recovery Centers as part of our Building Up Nonprofit Employees program. And on the months that we don't have these webinars, we have what we're calling Try It webinars. And they're just real light webinars designed to teach you a new skill. So we've had webinars on learning Tai Chi and beginning drawing and poetry writing. So we hope you'll watch your calendar for the next Try It webinar, which will be held on July 19th. The details of that are still being worked out. And we want to thank the Michigan Health Endowment Fund for their financial support for this series. We're going to be using a couple of features today as part of Zoom that you're probably familiar with, but one of them is, and they're both on the bottom of your screen. One is chat, and you can use that to talk amongst yourselves. We won't be monitoring that too closely, but if you'd like to submit questions to our presenter, Jess, put that in the Q&A, and Amy's going to help us with Q&A. Everyone will be muted during today's webinar, and we are recording it, and it will be emailed to all registrants within the next day or two. So with that, I'd like to introduce our partners from Great Lakes Recovery Centers. Amy Poyer is the Community Relations and Marketing Director, and Amy's going to be handling Q&A today. And Jessica Murawski is the Central Operations Director and will be our presenter today. So thank you both very much. And I'm going to go ahead and turn it over to the both of you.
Wonderful. Thank you. I appreciate it. So hi, everybody. I'm Jessica Murawski. I'm from Great Lakes Recovery Centers, and I'm the Regional Operations Director. And I'm excited to do this training today. So what I'm going to do is I'm going to stop my video so that I can share my screen and have the PowerPoint up. Nothing special here, so nothing you need to see. And then, like they had said, if you have any questions, feel free to pop it into the chat. Zoom webinars and trainings and stuff like that can be a little bit difficult because they're not as interactive. So that's like a really good way for us to engage with one another. So if you have anything, let me know if there's a question. So stopping my video, and then I got to figure out, I'll share my screen. And from the beginning. Okay, so hi, yep, here we are. So this training is on anxiety and depression, and there is nothing more ironic than being anxious about doing a presentation on anxiety when you have anxiety about doing a presentation. The irony is not lost on me, but we're going to get through this together. And so some of our learning objectives that we're going to be targeted today is we're going to give an overview of what anxiety and depression are. They can be pretty broad, so we broke them down into a couple different categories for us to kind of take a deeper dive into. So an overview of each of the disorders, exploring different types of anxiety and depression and different diagnostic subsets. I want you guys to be able to recognize some of the symptoms of each of the disorders when you leave here, have a better understanding of who may be at risk for developing an anxiety disorder or depression, and identify those who may be struggling with those things, and then have a better understanding of treatment options for each disorder. So moving right along, anxiety tends to be one of those terms that's tossed around a little bit, and it's a real thing, and it's also a disorder. And so we're going to unpack a little bit some of the differences. So fear, and we have our Mr. Nemo here about to get eaten by the shark. So fear is the emotional response to real or perceived imminent threat, where anxiety is the anticipation of a future threat. Anxiety can be is a completely normal and healthy response to stress. It's a symptom of something external that helps us tune in and focused on whatever that is, that's a threat, right? And so that little fish is fearful and anxious that shark is going to eat him. So he's trying to get away and needs that anxiety to kind of help him with his survival, right? The absence of the shark is leaving the fish with some anxiety though. He's perceiving the threat that the shark is still around. However, when that anxiety sticks around far after that threat is gone, is when we're starting to lean into it becoming an anxiety disorder. Anxiety is a DSM-5 classified disorder, and the DSM classifies anxiety as excessive anxiety and worry, apprehensive expectation occurring more days than not for at least 6 months. So there is a time period for it to be classified as a disorder. And it tends to be a fixation on future orientation, and individuals are stuck a little bit on future orientation and outcomes and not being able to control the outcomes or threat. They're kind of stuck in that state. Some of the symptoms of anxiety, and we'll go through each one of these, are being restless, fatigue, having excessive anxiety and worry, increased muscle aches and soreness, impaired concentration, being irritable, and having some difficulty sleeping. And so like we talked about, anxiety has a place in the world. It's purposeful for us, like in the situation with the fish trying to survive. What it does is that anxiety increases the adrenaline, right? It has, so that we can focus better and that fish can swim away. Pupils dilate so we can see better. The heart rate increases to pump blood to our muscles so that we become faster and stronger. When we're struggling to control our worry and anxiety, however, that anxiety disorder within our bodies like really starts to impact us because of those physiological responses of that anxiety, right? Which is why we see some of these symptoms that we'll unpack a little bit more. So being easily fatigued, like we talked about, our bodies are going through a lot when we are struggling to manage that anxiety and that kind of fight or flight mode. With our heart rate increase and our adrenaline is up, our body tends to crash a little bit, and it can cause a significant amount of fatigue with us. It leaves the body in a constant state of stress and feeling alert, which can be quite draining. It also impacts difficulty concentrating. Again, back to our poor little fish. When we're anxious, our body is perceiving that threat and reacting to it. Our body is reacting to the big shark that might eat us instead of if we're trying to study or if we're trying to watch a movie. Our body is responding to that threat and our brain is, even though the context might not be there. Restlessness. So again, our body is kind of in that state of fight or flight. So we're having a harder time sitting still and feeling settled, feeling a little bit edgy. Irritability, the anxiety can make us snappy because again, we're depleted of some of our normal stores of energy and just not quite to our full functioning capability. Muscle tension. So everybody's a little bit different with this. I know for me, I feel it in my jaw a lot where I'm like, oh, I feel pretty good. And then realize that I've been clenching my teeth all day. And I'm like, okay, that's a sign for me. Some people feel it in their chest or in their stomach or their neck or their upper arms, but everybody's a little bit different. But again, our hearts are pumping a little bit more than they typically would. And we're tensing our muscles, which can indicate some soreness. Also some sleep disturbances are another symptom of anxiety. So people may be up ruminating about different concerns, whether again, they're real or perceived. It might keep them awake. So insomnia is a pretty common complaint with those struggling with anxiety, but then also nightmares. Nightmares about anything that we're worrying about and waking us up in the middle of the night and impacting our sleep, which again, in turn, comes back to us feeling more fatigued and having a harder time implementing some of those stores to make us feel really good. So any questions, Amy?
No questions yet.
Okay, you sure nobody's saying that this is the best training they've ever heard so
Oh,
far?
actually, yes, there is one person who did say that.
Figured, okay.
Uh-huh.
All right, so we'll go into some different types of anxiety. So typically, for the intents and purposes of this training, we're going to unpack and use the lens of generalized anxiety disorder, which is the one I listed last on accident. But it's the most common form of anxiety. Anxiety, like we said, it's typically an umbrella term because there are anxiety disorders, and each one of these falls into that. They're differentiated by the types of situations that are feared and avoided. Each of the anxiety disorders share features of excessive fear and anxiety related to behavioral circumstances, but what is being feared and avoided is what differentiates these from one another. So starting with generalized anxiety disorder, again, this is the most common diagnosis of anxiety, partly because of how broad it is. And it's determined broadly through excessive worry lasting more days than not for at least 6 months about a number of events or activities. So it's not specifically, oh, I'm super anxious about work. It's that kind of general anxiety about life and circumstances that might not be congruent with what they are. The individual finds it very difficult to control worry, and it is causing significant distress in areas of functioning. So they're struggling to perform in work, school, or home in their social life because of how anxious they are. So normal daily activities can be diminished through this anxiety. Another disorder is separation anxiety disorder, and it's developmentally inappropriate and excessive worry regarding separation from whoever the individual may be attached to. And that developmentally inappropriate is important with this, as there are obviously developmentally appropriate distress, which would be associated with like younger children and their caregivers. There's a normal attachment with that where this wouldn't apply. But the context of that disorder is there is a fear which is excessive, which results in refusal or hesitancy to be alone or without the attachment figure. And in instances where separation is either anticipated or occurs, nightmares can occur, as well as physical symptoms like stomach aches or nausea, sometimes like panic attacks and things like that. Selective mutism is another type of anxiety, and it's the consistent failure to speak in specific social situations when there is an expectation of speaking, but the individual has the ability to speak in other situations. So that selective mutism comes on if there is an anxiety associated with work and all of a sudden they're not speaking. And the failure to speak is not related to lack of knowledge or any language barriers. It's specifically focused with the anxiety of the situation. There's also a myriad of specific phobias, and I'll give you a little overview on those, but it's a marked fear and anxiety about a specific object or situation. So flying, heights, animals, seeing blood, public speaking, perhaps. Those all can be specific types of phobias. And it's where the object or the situation almost always provokes an immediate fear or anxiety, typically out of proportion to the actual danger posed. So although public speaking is anxiety provoking, for somebody that has a public speaking phobia, it would result in a large amount of panic, a large amount of distress, and potentially inability to perform in the public speaking role because of how great the anxiety is. And for that to be a phobia, it would need to occur most often whenever they were public speaking. So if it happens once, maybe not necessarily a specific phobia, but if it happens every time, then potentially a phobia is there. So social anxiety disorder, this is considered a social phobia because it has some traits of specific phobias, but it's a little bit different. It's a fear or anxiety about social situations in which the individual is exposed to possible scrutiny by others. The fear there is the fear of the individual being negatively evaluated by others. And so that is what's precluding them from being able to be in social situations, is worrying about being embarrassed or something like that. Panic disorder is another anxiety disorder, and it's recurrent panic attacks. And panic attacks are an intense surge of fear or intense discomfort. It typically has a very quick onset. Some symptoms can include sweating, trembling, palpitation, nausea, chest pains, numbness in fingertips, and things like that. So it's a quick onset of symptoms, and for it to be a panic disorder, recurrent episodes would need to occur. All right, so there are some risk factors associated with who is more at risk for developing an anxiety disorder. Trauma, so children or adults who endure abuse or trauma, either endure it or witness traumatic events, are at higher risk of developing an anxiety disorder. A buildup of stress can also induce an anxiety disorder onset. Sometimes this can look like a death in the family, being worried about finances. Stress from school can trigger some anxiety and an anxiety disorder if they're not able to just continue ruminating for that. Different types of personalities can be more at risk for anxiety disorders. Some types of perfectionism, they're a little bit more prone to having an anxiety disorder. Genetics, so you can blame your parents or whoever you want. But anxiety disorders can run in families. Drugs and alcohol, so use or misuse of drugs and alcohol can also cause, as well as make worse, symptoms of anxiety. Some other causes medically could be heart disease, diabetes, thyroid problems, chronic pain, and then there are also some tumors that can constantly produce that fight or flight hormone that can mimic that anxiety disorder. So I was almost hesitant to put that in there because I don't want anybody like that's anxious thinking that they have a brain tumor, but it is a thing, so we put it in there. All right, so if we're going to move on to some treatment options for anxiety, any opportunity I had to put like a meme or a funny picture, I totally took advantage of that. So treatment options for anxiety. So therapy is kind of the gold standard, specifically CBT, when it comes to effective forms of therapy for anxiety disorders. And CBT is cognitive behavioral therapy. So it's really recognizing the irrational thought patterns that are contributing to the behaviors and finding those linkages for individuals to work through. Medications are another form of treatment for anxiety disorders. It's common for antidepressants to be used to help anxiety disorders. Sedatives like quick-acting Ativan or Xanax can also be prescribed for short-term relief of anxiety disorders, specifically for panic disorders. Or if somebody's really struggling, your doctor might consider that as an option. They're not intended to be used for long periods of time. Again, they're typically intended for that acute issue with anxiety and really short term because they work really quickly. Medications have a higher efficacy when used in conjunction with therapy. Just another thing to note, that we need to look at all different aspects of the individual when we're looking at treatment. There are also quite a few other lifestyle and home remedies that we can talk about that can help with anxiety. So regular exercise can really help by reducing stress and improving mood. Avoiding drugs and alcohol, like we discussed, as using these can sometimes exacerbate symptoms of anxiety. Unfortunately, cutting back on caffeine, as we see in the picture here, caffeine can really exacerbate the symptoms of anxiety and make things feel a little bit worse. by increasing the heart rate. So it's important to be mindful of this. No, I'm not telling you to cut out all the caffeine, but just something to be mindful of. Other alternatives would be to do some other things to help, would be keeping a journal. This can be helpful in identifying different thought patterns, again, associated with CBT. What you're trying to do with your therapist or on your own is recognize what some of those unhealthy cycles are and identifying like where the intervention for you might be. And it can help you identify some triggers to your anxiety to help unlock more of what the root of the issue is for you. Meditation and grounding techniques. These can be really helpful for those struggling with this, as it helps really bring them back to the present and get away from that future-oriented focus that we discussed earlier. It brings them back to today and the present with some mindfulness. So we're going to talk a little bit about grounding techniques and mindfulness, because again, specifically with anxiety, these can be very, very helpful, especially when somebody's like struggling in your office and you really want to be able to help them through that moment. They work pretty quickly and acutely, so they're an important toolbox to have. So mindfulness practices are becoming fully aware of surroundings, thoughts, emotions, and bodily sensations. By practicing this, we increase our awareness and our ability to self-regulate our emotions. So some forms of this would be meditation. So bringing our awareness to the forefront of our minds and recognizing when it wanders. There's many different types of meditation. There are like a bajillion YouTube videos and podcasts and soundtracks of guided meditation where the person on the CD can like really walk you through how to unwind and relax and what to shift your focus on, which can be really nice. Others find yoga, running, coloring as meditative almost, as they feel they are focused on the body or the situation as opposed to that future orientation. Guided imagery is another thing that you can find on YouTube or a podcast or something like that, where again, it kind of takes you out of that future orientation and onto something a little bit soothing. And then sensory, and then there's other different types of grounding techniques. So sensory grounding techniques, they tend to be effective for those that are new to meditation and relaxation because it physically brings you back to the present. And it's hard for people that, because the idea of meditation can feel a little bit nebulous if it's a new concept for you. I know I read this book years ago and it was called Meditation for Fidgety Skeptics, and it like completely put it in like layman's terms for me, and it was very, very helpful. But the grounding techniques, specifically physical, are kind of geared towards those that might not have a good understanding of how to meditate on their own, right? You try and meditate like this little, I don't know what creature this animal is, but he looks like a pro at it, but until you try to meditate on your own, you're sitting there sometimes thinking like, am I doing this right? And so the sensory grounding techniques is something that I'm going to walk each one of you through a quick little exercise right now. So if you don't mind doing this with me, I'll do it out loud since you guys are muted. But I want you in your spaces, if you feel safe to do so, to kind of follow along. So it's a 5, 4, 3, 2, 1 exercise, and you can do it right where you're at, and you're going through each of the senses. So first, you're going to do 5 things that you see. And so I see this cute little creature, a pink water bottle. I have a green tree outside of my office. That's 3. I have a shimmery phone case and a bright yellow highlighter. And again, you're really wanting to hone into that sense and really use it for the intention of getting my eyes placed on that object. So I'm describing it. And when I do this by myself, I'm describing it to myself. I usually don't say it out loud, but I'm entertaining you all. So next we're going to go to 4 things that you can feel, and you're going to actually feel them because again, we're bringing it back to our senses and bringing it back into today. And so I feel my desk, which is a little bit grainy, my computer, which is cold and smooth. My water bottle again is a little wet and my shirt is nice and soft. Three things that I can hear. I can hear the noise machine outside of my office. I can hear my voice, of course, and I can hear the blood pumping in my ears, also anxiety. Two things that I can smell, and again, you're gonna smell them. So I'm gonna smell my perfume. It smells pretty flowery. And then I'm gonna smell my chapstick, and this smells minty. And then one thing that I can taste, which is my water. So I'm gonna take a sip and think about how that tastes. So again, that took all of about maybe 30 seconds, but I already feel like $1 million and we're gonna crush the rest of this training, you know. But really the purpose is to bring us back into this moment and get us to stop spiraling about all of the things that we have to do or the other things that we're worried about. All right, any questions so far, Amy, or we're gonna move on to depression next?
Nope, no questions as of yet.
Okay, perfect. All right, so moving on to depression. So similar to anxiety, depression is a term that gets tossed around a little bit. It's sort of an overarching term. However, it can be also a mood disorder, and it's classified as causing persistent feelings of sadness and loss of interest. Again, similar to fear and anxiety, sadness is a normal reaction to difficult situations, right? That's a healthy emotion and a healthy thing to feel, such as depression can be. But the problem is when we start playing with it being a disorder is when that feeling doesn't go away and it starts to genuinely impact and kind of take over our daily life. Feelings of sadness can come and go, and you can go about your day. However, depression is that persistent feeling of sadness that impacts daily living, including how you think, how you feel, and how you behave. So some symptoms of depression, and these are right from the DSM of the classifications and symptoms of depression. So it's a depressed mood for most of the day, nearly every day. Feeling low or blue, not feeling motivated, feeling sad and withdrawn are characteristics of this. And typically it's when the environment is not necessarily conducive to this, although that can trigger this. Markedly diminished interest or pleasure in activities. So typically, if you or somebody enjoys being around people, going to the movies with friends, playing sports or games, there's a reduction in interest in that. And when you're feeling like you're withdrawing from that, that is a symptom of depression. Significant changes in weight. Individuals that might be struggling with depression have changes in appetite, which can vary from person to person. So some individuals struggle with overeating when they're depressed, while others struggle with a reduction of appetite. And so either one, they can cause fluctuations in weight, but that appetite change is a direct symptom of depression. So either craving sugar or other foods, and then the reduction in appetite. So that's why the changes in weight is noted as a symptom. Slowing down of thought and a reduction of physical energy. So this is a symptom that can be felt or observed by others, struggling to be quick with decisions and words, looking lethargic and feeling like you just don't have that kind of energy for quick movement or things like that. Fatigue and loss of energy, because depression can impact neurotransmitters associated with alertness and the reward system in our brain. It has a direct impact on our energy. Additionally, depression can have a negative impact on our sleep, which perpetuates the loss of energy that we see here. Feelings of worthlessness or excessive and or inappropriate guilt. So that inappropriate guilt is an overarching feeling of guilt, not necessarily tied to anything to be guilty for. It's like almost a guilt of existing and feeling worthless and low. Diminished ability to think or concentrate. So struggling to have clarity with thoughts, struggling to make decisions or concentrate on activities, even while trying to watch a movie or a television show can be difficult. Recurrent thoughts of death, recurrent suicidal ideation without a specific plan or a suicide attempt and or specific plan for committing suicide. This is another symptom of depression. And so we could, of course, spend the whole hour here, but I did want to pull up the slide to provide some resources for you guys. Unfortunately, thoughts on suicide or death are a symptom of depression.
Yes.
Yeah.
Before we move on to suicide, and that is a topic that I like, so I definitely want to get there. I do have one question for you.
Great.
So, and this I think would go with both the anxiety and the depression. Now, if somebody had a valid reason to be down, like say a spouse died or a parent died, but that extended to a length of period, is that still considered depression or anxiety, or is that not, if there's?
So that's a great question, and absolutely. So it would take a clinical diagnosis for that. And so what we're looking for, whether or not it's depression or struggling with grief or attachment with the loss, is the time frames. And so with depression specifically, for like a major depressive disorder, I believe we're looking at about 6 months after the loss is when it turns into a depressive disorder. And I can get some more information on that, but there's a time frame associated with how the individual is coping with that, to where it's either struggling with grief, loss, and attachment, and a depressive disorder. I don't know if that answered that.
Great, thank you.
Okay, yep, no problem. And similarly with anxiety, that there's a time frame associated with that, when that threat is gone, because again, that anxiety can be real, but when that feeling lingers for some time, that's when we're dancing with the idea that it could be an anxiety disorder. Okay. So back to this, again, thoughts of suicide are a symptom of depression. So I wanted to put this here, that there are resources available to you if you need it. This website has different resources available, including help and crisis lines and communication tools and training and other resources for that. So really take advantage of that. Like I said, I would love to spend probably a whole hour on this, but we'll need to move on to some of the other parts of the training. All right. So again, similarly to anxiety, there are different categories and types of depression underneath the depressive disorders. So major depressive disorder, this is the most common type of depressive disorder. The symptoms cause major distress. Ooh, I'm losing my tongue. Major distress or impairment in areas of functioning and unrelatable to another medical condition. The diagnosis includes 5 or more of the symptoms that we just discussed for at least 2 weeks. One of the symptoms needing to be loss of interest or pleasure or depressed mood. So the next one is disruptive mood dysregulation disorder. So this is categorized by severe recurrent temper outbursts. They can be physical or verbal that do not align with the situation. Outbursts are inconsistent with developmental level, so not necessarily a tantrum with somebody or a situation that might cause this, like an actual physical threat. And mood between outbursts is persistently irritable and angry for most of the day. Persistent depressive disorder. So this is where symptoms cause depressed mood for more days than not for at least 2 years. It also includes symptoms from major depressive disorder, but the individual has never been without symptoms of depressed mood for more than 2 months at a time. It's a bit longer term for symptoms than major depressive disorder, and symptoms are not attributable to physiological effects of a substance use or another medical condition. And then also premenstrual dysphoric disorder. So this is a depressive disorder when a majority of menstrual cycles have at least 5 of the symptoms of depression that we talked about in the final week before the menstrual cycle begins. And it's needed to be met for most menstrual cycles occurring the preceding year. So needing to have the symptomology prior to the menstrual cycle, just about through every menstrual cycle. And then following the menstrual cycle, when it stops, the symptoms of depression become minimal or absent the week after the menstrual cycle stops. So part of the reason that it's important to have the differentiation between the different types of disorders are the treatment associated with them are a little bit different. So that's why we have so many categories of anxiety and depression, is because each one of them can offer different interventions. So for the premenstrual dysphoric disorder, for example, although that can be treated sometimes through dietary changes, antidepressants, and we'll go over like some other treatments for depressive disorders, that one specifically can also be really helped through hormonal birth control and hormone treatment and stuff like that. So some risk factors for depression, certain personality traits, including low self-esteem, potentially being too dependent on others, being self-critical or pessimistic. So those individuals with those characteristics sometimes have a higher risk factor for depression. Trauma, again, comes up with this as a risk factor for depression, as it did with anxiety. So witnessing or enduring traumatic events as a child or adult. Depression is also prevalent in the LGBTQ community. Being a part of the LGBTQ community increases the chances of struggling with a major depressive disorder. Because of stigma and discrimination, those in the LGBTQ community are more likely to struggle with symptoms of depression. Nearly 28% more than heterosexual peers. And then just another stat that I wanted to share was 60% of the LGBTQIA youth identified as being sad or hopeless, and they stopped doing activities that they enjoyed, which is a huge percentage of youth. Having a history of other mental health disorders, including anxiety, eating disorders, or post-traumatic stress disorders. So those put people in a higher category of risk for developing a depressive disorder. Abuse of alcohol or other drugs can impact individuals' risk of developing a disorder, as well as impacting the disorder itself, because alcohol is a depressant, as well as having chronic illness that can impact somebody's risk for developing depression. Certain medications, including antidepressants, some blood pressure medications, and sleeping pills can impact development of a depressive disorder. I'm sorry, I lost my train of thought for a second. It's always super important to discuss with your doctor before stopping any medication, as discontinuing some medications abruptly can really drastically impact brain chemicals and contribute to a major depressive disorder. Yep, we'll talk about medications a little bit more in a minute. Brain chemistry is another cause of depression. It's something that's still being studied, how neurotransmitters and brain chemicals impact mood stability and play a significant impact on depression, and how it's treated. And it's not as cut and dry as I think we originally thought it was, because they're recognizing that some medications will increase serotonin and the same medication on another individual will actually lower it. So trying to figure out like how the different brain chemistry works with one another for individuals struggling with the depression. Hormones can impact depression as well, including hormone changes during puberty, pregnancy, postpartum, menopause, as well as thyroid problems. So some treatment options for depression. So we talked about a little bit about medication. This is where we pick that back up. So working with your doctor to find a medication, if this is a part of your treatment plan or somebody that you're working with their treatment plan, it's important to, as a part of the conversation, recognize that medications and treatment are not a one size fit all. It often takes people a few tries to find a medication that is effective for their symptoms of depression or anxiety, with the least amount of side effects that fits for them. Another reminder to, again, I think I just said this, I didn't realize like how closely this was to the previous slide, but it is very important that once you're starting a medication, if you're feeling like you don't like the side effects of it, or it's not helping, that you communicate with your doctor on that, because discontinuing medications abruptly can really severely increase your symptoms of depression and also lead to suicide. Therapy is another effective tool to help combat depression. Using CBT, again, is an effective form of therapy, as well as interpersonal therapy, recognizing that depression can be related to our relationships and unpacking that, as well as supportive counseling, helping individuals through support, through the issues that they're feeling, as well as problem-solving therapy, and helping to guide the individuals to find different ways to overcome issues. So there are a number of different self-help strategies as well. So support groups can really help to have people feel a little bit more connected and less isolated with the things that are going on, because our brain tends to trick us when we're in feelings of distress that we're kind of isolated and we may be the only ones that are struggling with that. But having a support network of individuals that are like-minded and struggling with the same thing, it can be very validating to talk to and to help support and to gain insight. There are many support groups online that you can find if you're struggling to find any locally. There's a lot of chat rooms and groups and things like that to find some support. Self-help books can also be a tool, and these can teach you things that you might learn from therapy or working with a therapist that might help be a step in the right direction for you if in conjunction with therapy, or if you are trying to pursue therapy. Other lifestyle changes, changes in diet can be a contributing factor to helping to improve depressive symptoms. Sometimes poor nutritional choices can increase our stress levels. And oftentimes when we're depressed, stressed, our bodies can crave foods that are high in sugar to increase that serotonin level in us, which can be a vicious cycle, because then our brain craves that happy chemical again. Crashes in sugar, spikes in sugar can exacerbate the feeling of exhaustion, and then it doesn't help with our serotonin. So being mindful of a healthy diet is important when working through, if you're going through a depressive episode, and general health, it definitely helps to prevent it as well. Exercise has been shown to ease symptoms of depression as well. Physical activity improves mood, and again, gets all those neurotransmitters firing again. Being mindful of sleep is also an important lifestyle change that we can make. As discussed, that one of the symptoms can be fatigue. So making sure that we get adequate rest is very important. So identifying some coping strategies. We got Buzz and Woody. It is important to recognize that there are things that we can do to help ease some of our symptoms and make some slight improvements. It is incredibly important, if you're working with yourself or our loved ones or clients, that we're working with them with grace while they are struggling with symptoms of mental health. One thing I always like to remind myself is that everyone is trying their absolute best, even if it only gets them so far. And recognizing, like, if somebody's in the pit of despair with low energy and a low mood, the last thing that they may want to do is create a bubble bath, right? Or go for a walk. And it's really okay to be graceful with yourself and your consumers, to be okay with that, and to know that you're doing the best that you can. Sometimes our self scripts get the best of us, and if we're not feeling like ourselves, we tend to be very shameful, and or people in our lives tend to be, without meaning to be a little bit shameful of, well, why don't you just go do this, go take a walk, and really just doing the best that you can. So identifying coping skills that are effective for you is important, that your coping skills or your friend's coping skills or your therapist's coping skills isn't a one size fit all either, right? And so you need to understand what works for you and what works best, and know that you're doing the best that you can. So we have a few common coping skills here. I would love for maybe you guys in the chat or in the question box to throw in some other coping skills that you found helpful for yourself. Making a list of things you enjoy can be really helpful. Having that list like taped up somewhere can do wonders in shifting your perspective and recognizing that there are good things that you love. And looking at the list of things that you love or enjoy or just kind of make you smile, it might even make you want to try one of those things, even if you're not feeling that well. Practicing gratitude is a great way to step outside of ourselves and be mindful of the good things that we have in our lives. Developing a wellness toolkit, because again, there's a lot of coping skills everywhere. That's why I put this little meme up, because everybody has advice and has really good intentions, but sometimes we need to know kind of what's best for ourselves and recognizing what has worked well for us. And so having kind of a toolkit of things just for you that help you feel good, whether it's spending time outside or reading a book or watching a TV show, having a list of things that you know that you've tried that have worked before, so you don't have to try and use what energy you have left to try and think of something to help make you feel better, right? You can just open up your notebook or open up your little box and it has some of those things for you. Getting sunlight is also important, and we've recognized this probably living in the UP, that vitamin D from the sun is critical to our emotional health. And so recognizing that spending some time outside is great, like wear sunscreen, but it's wonderful for us. Did anybody put anything in the chat as far as coping skills, Amy?
Well, one thing for me, there's a couple things. One, being creative, like any kind of creative, or else the breathing.
Mm-hmm. Yes, I love that. I love that.
And we have another one just came in, hiking.
Hiking is a great one, you know, that gets the physical exercise, gets you in nature, gets you in the sun. I love that.
Watching a comedy.
Perfect. I love to watch Friends, the series, just because I think it's so funny and like mindless. Like I don't really have to think too hard.
Not thinking is sometimes a really good thing.
Oh my God, it so is. Okay. Any other ones?
Ukulele. Either playing or listening.
What was that, Amy?
Playing or listening to ukulele.
Oh, perfect.
A little extra sleep.
You know, yes, like I said, like sometimes we need to just be very graceful with ourselves and give us permission to do things like that.
Yeah, that would be nice sometimes.
Mm-hmm. Yep, I think so too. I also, sometimes because again, going back to being graceful with ourselves, it's important to just be kind to ourselves and one another. I know when you're struggling with those kind of pits of despair, sometimes making a sandwich feels so overwhelming and you're laying on the couch like, oh my gosh, I need to get up, I need to get the bread, I need to whatever. And like, really, if you don't have to make a sandwich, right? Like you can put all of the ingredients of a sandwich on a plate and just be done. And like really trying to find those little tricks for yourself just to kind of get through the day and like get rid of all of those rules that sometimes we set for ourselves. Okay, so moving on. So anxiety and depression is a comorbid disorder. So we've covered both of those, and I know we're running out of time, but I think we're doing good. So we've covered those individually as disorders, but fun fact, they definitely can be concurrent with one another. And it's quite common for anxiety and depression to occur at the same time. So some studies indicate that 60% of those struggling with anxiety also struggle with symptoms of depression. And part of this is because some of the symptoms tend to mirror one another, which is why they might be like fatigue or something like that. There is a little bit of cohesion between the two. But then another reason that they might run concurrent with one another, more common than other disorders, is the symptom onset one of the causes, like we talked about, can be something external. And so the onset of the concurrent disorder occurs commonly together. Symptoms of anxiety and depression tend to be more persistent and intense when they work together, those little jerks. So when they're working together, sometimes the symptoms are a little bit more exacerbated. There is still a lot that we are discovering about working with anxiety and depression as a comorbid disorder, as it's important to treat them concurrently. Like, for example, if a medication is recommended to help the low mood by a doctor, like an antidepressant, but the anxiety is not improving, other interventions may need to be had, such as CBT therapy or another self-help group or something else to address the anxiety. So they really need to be treated as a pair. And again, like the therapies that we've talked about and the modalities, it's not a one size fits all. So having the unique opportunity to work with them together can make things complicated. All right, and I wanted to show you guys some screening tools that we have. These are pretty common and they're found in waiting rooms at doctors' offices. I know that we use them at Great Lakes because it helps monitor symptoms and improvements or regressions. Each of these are self-scores. So this is the generalized anxiety disorder. It's called the GAD-7, and the patient health questionnaire, the PHQ-9. And so each of these are self-score, and it gives a nice benchmark of improvements or otherwise. The intention is not necessarily to be a diagnostic tool, as in order to get a diagnosis, there are other clinical impressions and oversight related to each diagnosis. But each of these are like different criteria for depression and anxiety. So I wanted you guys to be able to see that, to be able to better understand some of the features of generalized anxiety disorder and depression. That is what I have. So yeah, I wanted to offer an opportunity to answer any questions, or if anybody had any comments or anything like that.
We had one more person say music in general as a coping tool.
Okay, yeah, music is another great one. And it kind of goes along with what you were saying, Amy, about being creative, that really helps kind of get you outside of yourself. So if it's playing music or listening to music, that's another great tool.
Yeah.
Yeah.
We've got a couple more minutes here, so feel free to submit your questions. In the meantime, I want to thank Jessica and Amy for their time today. We've got a lot of great information, and feel free to share the recording with other people at your organization as well. And make sure to watch our email for the next presentation with Great Lakes Recovery, which will happen in September. So I'm going to check back with you, Amy, and see if there are any other questions.
No more questions have come in at this time.
Perfect. So since we have a couple of minutes, like I'm good if you guys are, but I would love for everybody to put something that they're grateful for in the chat, and then we can kind of wrap up. And I'll go first. I'm really grateful for all of you for listening to this and kind of being a part of this. It was a pleasure to be able to do this and meet all of you.
We've got several people have commented. I will try and keep up with them all. The sunshine, my children, summertime, the ability to move my body and be active.
That's perfect. I love them. I love them. Amy, what's yours?
Right now, I would say mine is air conditioning, working air conditioning. Very
Right.
grateful for that. Yes.
Right.
Mhm.
Yeah, I don't know who said it, but I'm grateful for the sunshine too. I know it's hot, but I was like, oh, feels so good.
Where we live, for hikes with my husband and dog.
I completely agree. Completely agree. Okay, perfect. Thank you guys for participating in that. Appreciate it.
Okay, we'll call it a wrap, and we want to thank you all for attending today. And again, thank you, Jess and Amy. If you want to stay on for a bit, we can debrief.
Sure.
Sounds good. Thank you.
Yep. Thanks, guys.